I do have two follow-up questions. So, if so much of the research has debunked this myth that schizophrenia is a degenerative brain disease, why do you think it is still widely assumed by clinicians in the field that that is the case, or the general
Well,
public?
there's a few reasons. One, there's what's called the clinician's illusion. So if you work in a psychiatric hospital, say, and people come in with an acute psychosis, and then they get released once they're considered treated, or essentially what we do is symptom management. So you could look at the drug use, and I don't want to totally denigrate the use of drugs, by the way, because what they basically are is tranquilizers. So they reduce the intensity or the salience of experience, but they kind of reduce it globally. So yes, your terror, your fear, your paranoia, all these things are likely to get assuaged, reduced by those medications for most people. But so is your joy and your love and your passion and your motivation and all these other things, which, it's hard to live a good life without all of that's getting kind of turned down, right? But okay, so they leave the hospital, when they're considered quote unquote treated. And then you're only going to see the ones that come back if you're a clinician, right? So many of those people actually don't come back. So a lot of them actually, even with the, like I said, there's been plenty of research that the medications actually help in the short term for many people, but in the long term, they actually they make chronicity of the condition more likely. So, in given our particular mainstream mental health system, just already putting them on the drugs, telling them they have a brain disease, which acts as a kind of nocebo effect, opposite of a placebo effect. Already we're hurting the conditions for recovery significantly right there. But still, even still, many people still spontaneously recover, and they don't come back to the hospital. So as a clinician, you don't see them again. So you don't see the people who recover. So that's one reason. So there is a genuine kind of illusion that happens. And then the other reason is this is such a profitable industry. So there's basically a kind of psychiatric pharmaceutical complex, the two working together, that where the field of psychiatry rules the roost when it comes to mental health. But actually, if you look at the study of psychiatry, like if you become a psychiatrist, you're just basically a medical doctor with some extra training. And often the training is really coming from this reductive medical model approach to labeling subjective experiences with different, what we call DSM labels, mental health conditions, et cetera. But very few of them actually learn to do any kind of psychosocial interventions themselves. They're pretty much just drug prescribers for the most part. And so the combination of the kind of psychiatric field and the pharmaceutical field, they rule the roost of the whole mental health field, which is a multi-billion dollar, multi hundreds of billions of dollar profitable field. And um, and there's so much incentive to maintain that status quo. And schizophrenia is almost like that's sort of the golden egg in a way. It's like if you attack the whole construct of schizophrenia in a way, like the whole edifice of that medical model system will kind of crumble, because it's sort of, yeah.